For more anatomy related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
Hello everyone, in this video we will continue the anatomy of the oral cavity. So today's topic of discussion is the hard palate and also the soft palate. So first we will discuss about the hard palate. So this is the oral cavity and this is the hard palate. In the side view of the head you can see the oral cavity. This is the oral cavity, this is the tongue and this is the roof of the oral cavity, and the roof of the oral cavity it is formed by the hard palate. So the floor of the nasal cavity it is also formed by the hard palate. So which all are the bones which are involved in the formation of the hard palate? There are two bones which are involved in the formation of the hard palate. So which all are they? It is the palatine process of maxilla and also the horizontal plate of the palatine bone. So these are the two bones which are involved in the formation of the hard palate. So, anterior two-thirds of the hard palate it is formed by the palatine process of maxilla, and the posterior one-third it is formed by the horizontal plate of the palatine bone. And the bones of either side it is joined by means of the intermaxillary suture. That is the palatine process of maxilla of either side it is joined by means of intermaxillary suture, and the horizontal plate of palatine bone they are joined by means of the interpalatine suture. So it is a suturous joint. And again in the horizontal plate of the palatine bone there are two foramens. They are the greater palatine foramen and also the lesser palatine foramen. So on either side there are two foramens. They are the greater palatine foramen and also the lesser palatine foramen. So these foramens is through the greater palatine foramen passes the greater palatine nerve, and through the lesser palatine foramen passes the lesser palatine nerve. So now we will discuss about the margin of the hard palate. The anterolateral margin it continues with the alveolar arch and also the gums. So this is the alveolar arch. So the anterior anterolateral margin of the hard palate it continues with the alveolar arch and also the gums, and the posterior margin it is continuous with the soft palate. That is in the back side of the hard palate is the soft palate. That is in the posterior part there is the soft palate. So the posterior margin it is continuous with the soft palate, and there are two surfaces. That is it has the superior surface and also the inferior surface. The superior surface it forms the floor of the nasal cavity, and also the inferior surface it forms the roof of the oral cavity. So now we will discuss about the vessels and also the nerve supply of the hard palate. So first we will discuss about the blood supply. So the blood supply it is through the greater palatine branch of the maxillary artery. It is through the greater palatine branch of the maxillary artery, and the venous drainage it drains into the pterygoid plexus of veins. So the hard palate it drains into the pterygoid plexus of veins. And nerves, the nerve supply it is through the greater palatine and also nasopalatine branch of the pterygopalatine ganglion. So nerve supply it is through the greater palatine and also the nasopalatine branch of the pterygopalatine ganglion. So the lymphatic drainage it is into the upper deep cervical lymph nodes and also to the retropharyngeal lymph nodes. So it is into the retropharyngeal lymph nodes and also to the upper deep cervical lymph nodes. So now we will discuss about the soft palate. So this is the soft palate. So it is the continuation of the hard palate, and the soft palate it separates the nasopharynx from the oropharynx. And the soft palate it has got two surfaces, that is the anterior surface and also the posterior surface. So the anterior surface it is characterized by means of a median raphe, and the posterior surface it is continuous with the floor of the nasal cavity. So these are the two surfaces, and it has got the two borders, that is the superior border and also the inferior border. From the base of the uvula, this is the base of the uvula, there arise two mucus folds on either side. So these are the two mucus folds that arise from the base of the uvula on either side. They move laterally and downwards. So these folds are the anterior fold is the glossopalatine arch or the palatoglossal arch, and the posterior fold is the palatopharyngeal arch. That is palatoglossal arch, it is anterior. To remember that palato and glossal it is related to tongue. So palatoglossal arch it is anterior and the palatopharyngeal arch it is posterior. So the anterior arch is the palatoglossal arch, that is the palate and also the tongue. So palatoglossal arch. Next is the palatopharyngeal arch, that is palate and also the pharynx. So in this way you can remember. So in between is the tonsilla fossa, where you can see the palatine tonsils. We have already discussed about the tonsils when we discussed about the Valdes lymphatic ring. So these are the two arches which arise from the base of the uvula. So this is the uvula, from the base arises the two arches. And the anterior arch, that is the palatoglossal arch, it has got the palatoglossal muscle, and the posterior arch, that is the palatopharyngeal arch, it has got the palatopharyngeal muscle. So now we will discuss about the muscles of the soft palate. So which are the muscles of the soft palate? Tensor veli palatini and also the levator veli palatini. Tensor veli palatini, levator veli palatini, musculus uvulae, that is the uvula, it has got the musculus uvulae. Next is the palatoglossal muscle and also the palatopharyngeal muscle. So these are the 5 muscles of the soft palate. That is the tensor veli palatini, levator veli palatini, musculus uvulae, the palatoglossal muscle and also the palatopharyngeal muscle. These are the 5 muscles of the soft palate. So now we will discuss about the nerve supply of the soft palate. So first we will discuss about the motor nerve supply. So the motor nerve, all the muscles of the soft palate except the tensor veli palatini, it is supplied by the pharyngeal plexus. That is all the muscles except the tensor veli palatini, it is supplied by the pharyngeal plexus. And the tensor veli palatini, it is supplied by the mandibular nerve. So the motor nerve, it is from the pharyngeal plexus, and for the tensor veli palatini, it is the mandibular nerve. Next we will discuss about the sensory nerve supply. So sensory nerve supply, it is from the middle and posterior lesser palatine nerves. So it is from middle and posterior lesser palatine nerves. They are branches of the maxillary nerves. And also the glossopharyngeal nerve. And the special sensory or the gustatory nerve supply, it is from the lesser palatine nerve. That is from the lesser palatine nerve. So today we discussed about the hard palate and also the soft palate. So hard palate, it is formed by 2 bones, that is a palatine process of maxilla and also the horizontal plate of the palatine bone. Then we discussed about the margins and also the surfaces of the hard palate, then it nerve supply. Then we discussed about the soft palate. So it has got 2 surfaces and also 2 borders. And then we discussed about the 5 muscles of the soft palate. They are the tensor veli palatini, levator veli palatini, the palatoglossal and also palatopharyngeal muscle, and also the musculus uvulae. So these are the 5 muscles of the soft palate. Then we discussed about the nerve supply, that is the motor nerve supply, the sensory and also the special sensory nerve supply. So this is the end of today's video.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.